worker, helping to build the extension on the ED entrance. She was laying concrete block when the pain started to develop about 10 minutes ago, so they decided to walk in. Okay. Are you in the room or are you in triage?
They just brought me back to this room.
Awesome. Chris, my name is Toby. I'm going to be your nurse today.
Okay.
I
Hey,
hear
Toby.
you having some chest pain that started today while you were at work.
I really wouldn't call it pain. It just is like not normal. And the guys I work with wouldn't let me just keep going, you know.
Okay, we'll just call that discomfort, okay?
I'm going to put him on the monitor
What?
and
I'm
going to start a
large gauge IV. I just said that we're going to call it discomfort. So if I ask you about discomfort, I'm really talking about that feeling, that unusual feeling that you're having, okay? So we've got you working on the monitor.
No, I'm working on the construction entrance. I'm not working on the monitor.
We're going to put you on this cardiac monitor so I can see what your heart is doing, okay?
Okay.
I have a team with me. I have Meredith. She's going to be starting an IV and drawing some blood because that's going to help tell us what's going on. We're going to give you some fluid. You know, it's a little hot here in Vegas, so you might be a little dehydrated. So we'll give you just a little titch of fluid. And then Jen is going to get you on that monitor like we talked about so I can see what your heart is doing. She's going to work on getting a 12 lead EKG at the same time because that's really going to get the best picture of what's going on with your heart. Okay? Okay. Do you feel short of, thank you. Do you feel short of breath at all, Chris?
No.
Okay. Does this discomfort go anywhere else besides your chest? Does it go into your arms, your neck, your jaw, your back?
I don't think so.
Okay, great. Well, I'm just looking. What's that?
Should it?
I hope not, but tell me if it does, okay?
Me too.
It just helps me put the picture together if I know exactly what's going on.
Okay.
Have you been feeling any nausea or felt like you need to vomit?
I go for some coffee.
Okay. Do you drink a lot of coffee, Chris?
I like coffee.
Okay. Okay. No, I see your blood pressure is a little high. Do you have any medical problems that you know
of? Diabetes.
You've got diabetes?
The pill one, not the other one.
Excellent. Do you know the name of the medication that you take?
Mortformin.
Okay, metformin. Okay. Anything else that you take?
Marlboros.
Marlboro, you smoke?
Yeah.
Okay.
I mean, come on, who doesn't, right?
Okay.
And then, oh, what the hell is it called?
Lipitor?
Yeah, that one. Something about supposed to be bad for your joints, but it's supposed to help your fat or cholesterol or something.
Yeah,
that one.
Okay, so you have high cholesterol and
Yeah.
Do you have any family history of cardiac problems? Have anyone in your family had heart attacks or anything like that?
V2.
No. My dad was a construction worker. I'm a construction worker. My mom was a baker. No.
Okay. Well, so I'm looking at your 12 lead EKG and there's some things in here that are a little concerning to me.
Yeah.
I'm going to be sending off some labs, specifically some cardiac enzymes like troponin. I'm going to be checking your cell counts, your CBC, your BMP. Yeah. And I'm going to just put in a D-dimer as well. You've not been exposed to anyone with COVID-19, have you?
No.
No, if
I have, we probably all still came to work anyway because we got to get the entrance done because we're under a time crunch while the census is low or something. We're supposed to get it done or something. I don't know. Just been busy.
Okay. Are you getting the EKG interpretation?
Yeah. What was it? We had like the V4,
V2, V3, V4. Yeah.
And V3 leads are elevated.
A little AV. Yeah.
And per our protocol, we should probably give him an aspirin if he hasn't taken aspirin.
Do you have any allergies to any medicine, Chris?
What's that?
Do you have any allergies to any medicines?
Sulfate, sulfa, something, some sulfa, something.
Okay. Just sulfa?
Yeah.
Okay, what's going on? You look a little uncomfortable.
My freaking hand hurts.
Which one?
My right one.
Really? Okay.
I wouldn't
Is it
lie to you.
possible that we can see the
Monitor.
MRX again? Okay, thank you. Okay, so your right arm hurts?
My hand-ish kind of, it feels like weird. Feels like a smash. You ever smashed your hand with a hammer?
I have not.
Oh, I have. It feels
Okay.
kind of feels like that.
Let's recycle the blood pressure. And I'm going to start on a IV on this side over here.
And then I'm gonna grab.
Probably like
Chris,
yelling
have you
into this.
taken any aspirin, or are you on aspirin at all every day?
Oh God, no.
Okay, so I'm gonna
We
get you.
you take aspirin, work in construction, you'll look like a purple tomato, you know.
Right. Well, with our protocols that we have when you're having this chest discomfort and what we're seeing on the EKG, I'm going to grab you an aspirin dose of 325 milligrams, and I'm also going to grab you some nitroglycerin because you're having that chest discomfort as well.
That sounds super.
Yeah, and then we'll probably get a hold of our cardiologist to come take a look at you and take a look at our EKG, and hopefully our blood work will be back by the time our cardiologist shows up.
Okay.
Okay, looks like your labs, so far everything I've got looks good.
We're just gonna
That's
put a little cannula in your nose just to help kind of ease that workload, okay? So 2 liters
Sugars are
oxygen in your nose.
Your
Okay.
glucose level looks good. Oh, your D-dimer is up.
Who's
Okay.
that?
It's just a lab that helps us determine if you have maybe any blood clot formation in your body.
Oh, what is it? Does up mean I'm good or does up mean I'm down?
Well, up is not something we'd like to see. We'd like to see it in a normal range, and yours is a little elevated.
In construction,
But you're in the
up means
right
good.
spot.
You're working.
You're in the right spot, so definitely. So we're gonna also get a CT of your chest,
Oh, okay.
CT angio, so that we can check and see if you have any blood clots in your lungs. But you don't feel short of breath at all?
No, I just
Okay,
my
that's good.
hand. Now it's kind of like here-ish. I don't know if you.
Is
Is it
Um,
Is
swollen?
it swollen
Can
compared
you
to your
show us
left?
both of your arms?
No, no, it's not swollen. It's like you get it pinched, you know, like you get it pinched in between like a drawer, like a piece of machinery. It just feels like that. It feels weird.
We check radial pulses and cap refill on both sides.
What you mean like this? Does it are they pink? Yeah, they're pink.
They're both pink.
Yeah.
And do we feel a strong pulse on both sides?
This one over here feels a little stronger than this one over here.
Okay.
I took a first aid class for OSHA, so I know what you're talking about.
Good.
Yeah.
Good.
Excellent.
Yeah,
Yeah,
those
it was
those
online
videos
class.
are great.
Yeah.
Okay. So we're also gonna order an ultrasound just to check for blood clots in that arm.
Okay. I don't
And
know what is that? What does that mean?
well, it looks like you've got a really big heart. I bet you knew that though.
My mom says that.
Yeah. Do you see anything? I mean, it's all full of fluids.
Yeah,
so.
that side in the
Um,
left lung is pretty whited out.
Can
over
you
there.
do you have like pain? Like I don't normally like pain's not a big deal. This tingle hurts like hell.
Can we recycle a blood pressure on that monitor, please?
Do you have any blurred vision?
Oh,
No? Okay.
should I?
No. Tell me if you do though.
I will.
Okay.
Yeah, have we gotten our troponin back yet?
Yeah, have we gotten, we're just
Alright.
waiting on a
Electrolytes?
troponin and some electrolytes.
Have we heard from our cardiologist? Have they?
And has the cardiologist paged back Dr. Perkinji? Has he called back yet?
This is Dr. Perkinji on the phone.
Yeah, hey, Dr. Perkinji. We have a 40-year-old construction worker that came in today who developed some chest pain or just chest discomfort. And then now he's telling us he's got some right arm discomfort, especially in his hand where he feels kind of numb and tingling. He's hypertensive, 162 over 100. He's tachycardic at 108. His sats are great at 96%. We put him on 2 liters of O2. We've got a 12 lead EKG that shows some ST elevation in V2, V3, and V4. And we've given him some aspirin. He denies any COVID-like symptoms, but he says it's possible that he's been working around people with COVID-19 because they're on a pretty strict deadline. His D-dimer is elevated at 2.1, but all of the other labs we've gotten so far look pretty good. What are you thinking?
Well, I can come take a look at them, but I'm at the gym right now. My jazzercise class is about to start, so I'll be in after that.
Jazzercise. Excellent. Okay.
Well,
We did order a CT angio. Just we're a little worried.
Okay.
Do you think that's okay?
Yeah, that sounds good.
Okay. We're going to get an ultrasound of that right arm. Look for any blood clots.
Do we start
All right. And what'd you say his blood pressure was?
His blood pressure's a little high, 162/100. We were going to give him some nitro to see if that helped bring it down.
Okay. All right. Do what you think is best. I'll be in a little bit.
Okay.
Got it.
Oh, his troponins way high, so we're
How high is it?
definitely 1.9.
Okay.
Okay. So, Chris, we're definitely concerned that you're having some damage going on in your heart right now. Okay. We think that's what's causing your pain. So we're going to give you some medication to see if it helps with your pain.
Okay.
So you're going to put this medication underneath your tongue and you're going to let it dissolve.
Okay.
good.
Thank you. Okay.
problem.
And we're going to just sit here and talk. Is there anything else that you can think of today that's been different, or how you've been feeling over the last week or so?
Huh? Is it what?
And we're going to also give you a dose of some medicine called Lasix, because we saw some fluid around your lungs that we didn't like. So we're going to give you some Lasix. And have you ever heard the saying,
man, my chest. Now my chest hurts. What would you give me under my tongue?
Oh, well, we won't give you any more of that.
You get a new blood pressure.
Yep. We're going to recycle a blood pressure here.
We could do a little more, a little fentanyl maybe.
Oh, morphine.
Yeah.
Well, morphine. I mean, either or, depends on what the provider preference is.
We're just going to check your blood pressure, and as long as it's still okay, we're going to give you something.
40
We're going to give you some Lasix here.
Okay.
And you ever heard the saying, pee like a racehorse?
I'm in construction. That's what we do.
I can't hear you.
I'm in construction. That's what we do.
Okay. So we're going to give you this medicine that helps kind of get some of that fluid off of your lungs, okay?
Yeah, that's cool.
Chris, is your chest pain changing? Is it moving anywhere? Is it moving to the middle of your
Kind of
back?
like in my back, man.
Have we gotten that yet?
Yeah. Have we gotten,
What?
is CT ready for us?
Is what?
CAT scan ready for us?
We're going to take you over to a different area of the ER, Chris, and take a big picture of your whole chest and the blood vessels within your chest.
Okay.
The 129/82 for the nitro.
Okay.
Well, our blood pressure is
Good.
better now, and he didn't receive the nitro made the chest pain worse. That could have been just
But I mean,
coincidence.
do we
But,
want pain
yeah, do
meds
we want
on
fentanyl
board
or
before he
morphine?
goes to
I would give him
CT so he's more comfortable?
We're going to just give you a titch of morphine. It's a medicine that's going to help with your chest discomfort.
4 milligrams.
A titch of, I don't even know. Is that even English?
It's Minnesotan.
It is. It's Minnesotan.
Oh,
So
yeah.
Okay.
it's just a medicine that's going to help you feel better, okay?
Yeah,
Right.
that's cool.
Okay.
Here's the
Um,
morphine.
4 milligrams.
4
Might make you a
milligrams of
little bit-
morphine.
Sleepy, Chris.
And then we're going to get you over for that CT.
Okay.
Okay.
Morphine's in. Do we?
Yeah.
It's like in my back, man.
Can we get blood pressures on both sides, Chris? Both of your arms? We're going to do a blood pressure on both sides.
So the one up is left. So you'll switch it over to the right.
Yep.
Okay.
And then the bag of fluids that we gave you is empty, so we're going to start another small bag of fluid, about 500 cc's.
I don't know what that means. I don't have to pee yet. Is that bad?
No,
No.
it's
gonna have to
fine.
feel like a racehorse. I don't
Takes
like,
a little
say you're not cool unless you pee your pants.
bit.
So we could, if he's this anxious to try to get into that CT, we could do a little
It
verse
hurts, man.
just to kind of relax.
Guys,
him a
we're
bit.
going to do an ultrasound here at the bedside too, and we're going to just look at some of the vessels in your chest and see if that helps indicate what
Yeah.
might be going on.
90/57. For
So we
his
really
right.
need to get that that chest CT done, And I'm going to just call a surgeon and talk to him about the possibility that we have some sort of a dissection going on here.
I don't know. What's that mean? What's a
It just means one of the vessels in your, that big vessel that comes off your heart. Sometimes it has a little outpouching.
Like a vessel, like a boat?
No, like
like
the
a
vein,
tube.
your veins in your body.
Oh, gotcha.
Sometimes it can have like a tear in it. Yep, and
Something.
it can be causing this discomfort. So we're gonna get that surgeon in to see if that's what he thinks is going on.
CT is ready.
CT's ready?
CT's ready.
Okay, we're gonna go to CT.
Dr. Perkins is enjoying his jazzercise class. Look at how
Should we
happy
update
he
Dr.
is.
Perkinji about
All right, we're at 15 minutes, so we'll stop there.
Okay. Oh boy.
Nice work.
Oh my Lord. CT's ready.
For God's sake.
I like that. Yeah, I like push him to CT. I'm pushing him to CT as we speak.
Yeah. Do you want for the recording, because the recording will be on the ENA website, do you want to give Gail a shout out so it'll be for everybody to see since she didn't log in?
Okay. Gail, we love you, and you are gonna kick cancer's ass.
We love you, Gail.
Love you. Love you.